Okay, you're responding to Weber State University, where there is a victim, unknown, unconscious male, 22 years of age.
BSI is my scene safe.
It's safe.
Okay, as I approach my victim, my mechanism of injury and nature of illness is unknown at this time. I just have the one patient.
One patient.
Okay. I'm going to call for ALS backup due to we don't have a history really on this patient, and C-spine, we're going to take C-spine precautions. Can you come hold the head for me? I just want you to hold it right in line. Make sure it doesn't go, it's just going down midline for me, okay? Sir, can you hear me? Okay, I'm doing a painful stimuli, trapezius pinch and a response.
No response.
Okay, so I'm going to check an airway. Do I have any breathing?
Very minimal breathing.
Okay, so I'm going to do a jaw thrust to open. Does that improve his airway at all?
It does.
Okay. At this time, since he is unresponsive, I'm going to use an OPA to hold my airway open, keep it patent. And about what rate are we looking at depth?
He's at about 10 a minute, and depth is fairly shallow.
So I'm worried about depth, so I'm considering a BVM. I'm going to try a non-rebreather 15 liters to start. Try a pulse oximeter and see if I get a better read. What are we at?
Okay, so his respiration effort is being assisted, and his pulse ox is now going up to 94%.
94 we can handle. So at this time, my airway is being taken care of. I don't have any, do I see any signs of injury to his airway, tracheal deviation?
Negative.
Second sound. Okay. I'm just going to feel his ribs as he's breathing. See
He's
if I
breathing
feel
and he's being
flat
assisted,
chest.
yes.
Okay. And I'm going to listen to lung sounds to make sure we have good lung sounds in all quadrants.
Good. 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 Good.
Okay, so I feel my airway secure. He's breathing adequately this time. I have a good strong pulse. Capri feels good at this time. Skin is pink, warm, and dry, normal. And I'm going to do a blood sweep. I'm actually going to do a rapid scan. I'm looking for life threats and a blood at the same time. So checking my hand, the shoulders,
Negative.
check the arms.
Negative. Negative, no bleed.
Nothing on the front.
Negative.
Okay. Nothing.
Negative. You feel a little crepitus in that leg.
And the right? Okay. So this time, do I have pulses?
You do.
Okay. So just crepitus, no bleeding. I can splint that to the board, so I'm not going to worry about that. And I didn't find any other bleeding life threats.
Negative.
Okay. So this time, I feel this is a priority patient. I'd like to get going. I'm going to get him on a backboard. Okay.
Okay.
So I'm going to check the neck real quick. Checking the neck for any step-offs, JVD, tracheal deviation,
Negative.
decap VTLS. My size of my collar. Sir, can you hear me? This collar's a little big. This collar's bad, actually. I still have no response from my patient. I would be looking for any medical alert tags to clue me into allergies, medications, any medical history.
Okay, he's got one, he's got a little medical alert tag you notice,
Okay?
and it states that he is diabetic.
He is diabetic. Okay, so I'm gonna hurry and get him on the board and we'll start some vitals. Let's check his sugar on him. Okay, this time we're gonna roll our patient. I want you to keep his head in line for me, okay?
Okay.
Just keep him right down the middle of his body. On your count on 3.
Okay, 1, 2, 3.
Okay. This time I'm gonna check the back. I'm gonna expose. Checking decap, BTLS. Check the ribs on the back. Anything
Intact.
found? Okay. Okay, on your count.
Okay, 1, 2, 3.
Okay, we're just gonna slide them up into you.
Okay, 1, 2, 3.
Okay, so I'm gonna spider strap them down.
Okay, consider that done.
Okay, and then we're just, thank you for, did you see anything, by the way? Should
I
ask you
did
before I let
not.
you go. Excellent. Okay, I'm gonna start a set of vitals. I'm gonna start with the sugar
Okay, his sugar comes back to 80.
at 80. Oh, 80, so sugar is good at this time. So I'll do a full set. I didn't have anybody on scene, is that correct?
Correct.
Okay, and my airway's still good?
It is good.
Okay. Pull pulse oximeter still reading high 90s?
It's up to 96.
Excellent. Okay, I'm going to pulse obliterate my patient for blood pressure. Pulse is still strong and regular. (118/72). I'm just going to keep the blood pressure cuff on so I can come back to another set. (62 on the pulse). (16 on respirations). My lung sounds were clear. I'm going to reassess them at this time. Make sure we still have good, clear lung sound.
Clear. 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 And clear.
Okay, I'm going to check pupils. Pupils are pearl, equal, and reactive. I didn't see anything in the surroundings to clue me into any overdose type things, did I?
Negative.
Did it appear he might have fallen? Because of the
That's
cramps in
uncertain.
the leg? Okay, so this time I am thinking we have a trauma situation. So I call my ALS crew, let them have any updates so they can be prepared when they get here. And en route, I'm going to do a detailed physical exam. I am going to call medical control, let them know we're coming in. So McKay, this is Weber Rescue 1. Do you copy?
Go ahead, rescue 1.
Okay, this time we have a 22-year-old male that was unresponsive upon our arrival. At this time we feel it's a trauma situation. Nobody was on scene to let us have any medical history or anything to what might have happened on scene. His blood pressure was 118/72, pulse of 62, and respirations were at 18. Sugars at 80, and no signs of overdose or anything at this time. We're about 5 minutes out. Do you have any questions or concerns?
See you in 5, rescue 1.
Sounds good. This time I'm going to do a detailed physical exam. I'm going to expose everything, looking for DCAT, BTLS, deformities, contusions, abrasions, burns, tenderness, lacerations, and swelling. Okay, I'm start of the head, checking the scalp.
Little bruise on the back of the head.
There is a bruise, and
Mhm.
my pupils were equal and
Yep.
reactive, correct?
Yep.
Okay. Okay, checking.
Little hematoma, that's all, just a little bump.
Okay, so we are trauma here. Okay, I'm going to do eyes again. Any changes? Still pearl. I'm going to check in and on the back of the ears for any bruising, CSF, or blood. I'm going to check the nose again for blood or CSF. It is. Okay, and then I would open the mouth. Do I see see anything in the mouth?
Negative.
Okay. I'm going to check the neck. I did check it before, but I'm checking for tracheal deviation since it's a late sign or any JVD.
Negative.
Okay. Check collarbones and shoulders. Let's check the sternum. Check the rib cage. Still anything?
Negative.
Okay. Abdomen,
Negative.
pelvis.
Intact.
I don't feel the genitalia is necessary this time since the pelvis is intact. Okay, I'm going to check the upper leg.
Intact.
Lower.
Just crepitus on that side.
Okay. Lower. And we are splinted to the bone
Okay.
this time. Just check the kneecaps. Make sure they're in the right spot. Check for pulses. Good strong
Intact.
pulses. I'd have them push on my hands, but
Okay.
they're not responding. Sir, can you hear me? Still painful stimuli. No response. Still is my air. How's my airway?
Good.
Good. So breathing adequately. Good strong pulses. So at this time, any interventions, I'm just going to keep reassessing my airway, check my pulses. I'm going to reassess my vitals at this time.
Your vitals now are what your heart rate is 120, your blood pressure is 100/70, and your respirations are being assisted.
They're being assisted with BVM now.
Right.
Okay, so I feel my patient's going into shock, so I'm going to treat him for shock position. I elevate his legs, cover him with a blanket, keep him warm, and then just make sure that oxygen's helping and that it's adequate. Call medical control, let them know of any updates, and call ALS and let them know of our changes.
Excellent, very good.